Ask any expert what social protection is and you won't get a straightforward answer. The reason is social protection covers a number of initiatives that affects different segments of the population. Think pensions for the elderly, cash transfers for families without regular and decent employment, or skills training for youth. But to make a distinction, experts usually categorize this into three: social assistance, labor market schemes, and social insurance. The contributions that employees and their employers pay the government on a monthly or annual basis go to social insurance. In some cases, governments subsidize the cost for those without formal employment. This is called non-contributory social insurance, which in some countries cover basic healthcare. The policy, however, could have disruptions in the labor market. Let's say this huge umbrella is the government's social insurance initiative. Employees are paying the government so they can have a safety net when it pours. This doesn't cover informal workers, such as street vendors, so the government decides to extend the umbrella to cover them when it rains. They don't need to pay the government anything, which could lead to a complacent workforce, a smaller tax base, and therefore a smaller budget for social protection programs. There's a variety of case studies of Latin American programs that show these consequences, and experts call it bad policy. But money isn't the only answer to unlocking good social protection programs. Take Singapore, for example. The assumption is that as a country that has the highest per capita income in the Asia-Pacific region, Singapore has good social protection programs. But some experts argue against that. Despite its economic growth, Singapore only spends 4.7% of its GDP on social protection, and more than 90% of this goes to its Central Provident Fund, a savings program to which its working citizens contribute and from which they can withdraw when they reach the age of 55. Essentially, it's a big piggy bank where citizens and employers make contributions so they'd have money for healthcare, housing, and other retirement needs or wants. The program, however, has had its share of criticisms over the years, mostly from its beneficiaries. These include spending flexibility, government transparency, and the adequacy of the fund when members retire. This is a key issue for the Southeast Asian country and other ASEAN member countries which need adequate programs to take care of a rapidly aging population. While youth continue to cover the bulk of the population at present, the number of people above 60 is expected to reach 21.5% of the entire ASEAN population by 2050. Countries, however, should be cautious in launching new programs or initiatives, especially if their fiscal and human capacity does not allow room for it. More social programs doesn't necessarily mean better, experts argue. Let's go back to the umbrella. While it might be a good idea for the government to hand a lot of umbrellas, that could lead to poor coverage and targeting. What will happen is that there will be too many insignificant umbrellas scattered across the country, benefiting a few but failing to keep dry those drenched in the rain.